thank you very much, everybody. What I'd like to do is to talk a little bit about how we're taking the framework forward, and the whole essence of today is to get your views and your thoughts and your ideas on developing our action plan in order to achieve the goals. Have you all seen the framework? Yeah? Anybody not seen it? No? Great. Talking to the converted, as was previously mentioned. Does this...
Probably not.
No, it doesn't. Okay. My first slide is a little bit of a duplicate, Jill's, but that was going to happen, obviously, because we're all here working to the same end. And obviously the legislation and strategies that the Welsh Government has brought forward more recently lend themselves to us developing our public health and preventive role. So where we're at now is we've got our framework and our goals with, and we very much acknowledge the work done by Linda Hindle and colleagues in England and our conversations with people in Scotland and Northern Ireland in terms of starting our journey, as we started a little bit later than England, and obviously we'll be hearing about progress through Linda's talk next. So the Welsh Therapy Advisory Committee proposed to set up an implementation plan through a subgroup, and I chair that subgroup, and nearly all the members of that subgroup are here today, either facilitating, presenting, or certainly taking an active part in today's proceedings, which is great. And we're a really good, enthusiastic bunch who have really taken this to heart in terms of where our professions are going in this area of work. We're in a key position to embed preventative healthcare principles across a range of our services. And it's not just about our individual one-to-one contacts, and as Jill mentioned, it's about looking to the population approach and what else we can do on a bigger, more strategic level in terms of our experiences in the health service with people and our skills in communication and on a one-to-one and a group basis, and working with communities. I mean, we've done it all amongst us, and I think we need to embrace that in taking forward the prevention angle. It was published last year, and it outlines obviously some of the ways in which we can contribute towards promoting and protecting health and well-being. And in terms of taking the goals forward, that's what we'll be focusing on in the workshops. So in terms of how many are we? There's a lot of us. There's always this doctors and nurses thing, and then we're the AHPs, but I think we're getting there now. And I think the more we put up this slide and say, yeah, there's a lot of us out there. And funnily enough, I tried to get the numbers of AHPs in social services and local authorities, and I couldn't quite get the accurate statistics, but I think that's something that we do need to do. So the occupational therapists recognise there that there's another 350 in local authority social services, and speech therapy includes a number in local authority on sort of SLA contracts, but correct me or add the numbers in if I haven't got them correct. We're 25% of the clinical workforce in Wales, so that's huge, and I think the fact that we've got groups of larger AHPs, such as OTs and physios, and then our smaller groups, art therapists being the smallest, in terms of 12, but play a really, really important part in prevention and public health, and that's really coming through now. So I think we can help each other by the fact that we do have different numbers of AHPs in our different professions, and we can work together collectively. So what we set out to do after the framework was to find out where we're at, really. We wanted to identify current practice across the professions in Wales so that we've got some sort of baseline for evaluating how effective we are with our strategic framework. We wanted to look at some of the gaps in provision and how we can progress each goal and help to identify and agree the priorities going forward, because we can't do it all at once. So the initial questions that we asked our professions is what's already being done? What do you think you're doing already in your role that contributes towards our public health vision? What's already planned, which will also contribute? What gaps are there? and what do you think needs to happen to address these gaps? And we had a really good response. We've had a response from all the professions and all the health boards, but not from every profession in every health board. But that's life. But I think we've got quite a lot of information which we're sifting through at the moment and trying to put together a quite succinct report, because I don't want to be an unwieldy masses of pages of loads of things that we do. It needs to be quite succinct to be able to move forward from that. So what I thought I'd do today, these slides are a little bit wordy, but I just wanted to give the whole range of things that we're doing, what we're doing currently, and what people felt there were the gaps. And I think developing the workforce was one of the really busy areas that lots of people had lots to say about, and I'm sure we will later on, as it's one of our workshop topics. So currently we've got some dedicated public health roles. In dietetics, my own role, and Lisa Williams as the National Nutrition Training Facilitator. Speech and language therapy and psychology are dedicated public health roles. But we could expand that, and I think there's plenty of scope to get more AHPs in dedicated public health roles. And I think as well, Jill mentioned, a lot of public health is about the one-to-one with AHPs, and everybody talks about MEC. MEC is very, very important, and having healthy conversations is very, very important. There's a huge amount we can do in impacting on that population health through the millions of contacts that we have. But we also need to start thinking about our wider, broader public health role. It's starting to feature on a lot of our professional conferences, and the professional bodies have taken it on board on a UK basis, which is obviously where the work in England started. We're also starting to look at developing others and their public health role, and there's definitely been a shift in emphasis. Some of the gaps on the right-hand side, we do have gaps in training. We're not talking about pre-registration training today, but obviously that's a real biggie in terms of embedding that public health approach when our professions start training. And we do have guidance on that now, which has come again from a UK basis. And perhaps that will be another conference or seminar with the colleges later on. Some of our survey results suggested that people do need a bit more confidence, so they've got the knowledge, but they may not have the confidence to raise issues around public health. More interface with public health. It's a big service now, public health, but there's the core service, which is specialist, and then there's the wider public health force, and perhaps we need to look at how better we can interface those two things. There's scope for further dedicated roles. Been a lot of talk in the psychology around informed practice at population level and the role of physios in exercise promotion. Obviously nutrition, dietetics, we have an established public health dietetic service. And all the work around ACEs and prevention is sort of ripe in a way for a lot of involvement of AHPs. And it's opened up a huge area of development. Goal 2, demonstrating impact. We've got quite a couple of areas where there's been some really innovative work in demonstrating impact in relation to our public health work. The use of results-based accountability in the Nutrition Skills for Life scheme across Wales, and the Flying Start speech and therapy outcomes around speech and language and communication delay of problems. There's a very unique and innovative programme that was started in North Wales around health and disability sports, where they've demonstrated a return on investment. And there's some really good examples of how the impact of integrating MEC into services has shown, again, some outcomes, and that will be demonstrated this afternoon in the workshop. But again, we've got more gaps. We need to be looking at how we can do this on an all-Wales basis. We've had some initial discussions with Peter Cumpstone, who's the new therapy advisor in the community IT therapy information system. And we'll all probably go, ooh, that. But, we're getting there. And I think it's important that as an all-Wales IT system, that we do integrate some public health information and recording into that. And then look in the future and longer term at identifying population-based outcomes. Increasing the profile. I think we're pretty good at shouting about ourselves, I think, as a group of AHPs, but there's always room for more. We've got established services, some established services in public health, and the partnerships, as I've just mentioned before. And there is a UK drive across the professional bodies to take this further. But again, those gaps and priorities are around investing more in our social media, increased use of podcasts. I know there's going to be a little bit of filming today to put some podcasts on the website. And looking at things like awards. There are awards in the public health conferences on a UK basis, but we can start doing that on a Welsh basis as well. And having further links with the local public health teams, perhaps having public health mentors, and further developing our public health network. Strategic connections. I think this is more about, on a national basis, I think we have our strategic connections. Our new Welsh Therapy Advisory advisor, Ruth Crowder, is going to be here this afternoon, which is quite well later on this morning, and she'll be closing today's event. But we have a very established Welsh Therapy Advisory Committee that is supporting this work and has links, obviously, with the Minister. And we have support from the Directors of Therapies and Health Sciences. So I think we are there, but we need more support, and as Jill mentioned, in relation to other directors in health boards to take this forward more locally. In terms of leadership, we've got a couple of national roles and obviously our Chief Therapy Advisor. There has been a lot of interest and suggestion that we should have a national AHP lead role, and perhaps Linda can talk to us about that, as that is how her career started in this area. And identifying support required for profession-specific AHP leaders. And reducing the challenges of delivering opportunities alongside core services, because that's still some of the sort of barriers that we have in terms of some of the more acute services where people don't see the time. But I think we've come a really long way, because when I first did an awareness raising speech, talk, presentation, whatever, at UTAC conference 2 or 3 years ago now, there was a lot of barriers presented in terms of, oh, that's not about us, we don't do that, we just see patients. And I think 3 or 4 years on, it's incredible to see the interest that we've got and enthusiasm. So I think, we definitely are getting there. And the last goal about health and well-being, I think this is an area which is really developing well, and AHPs are getting involved in the services in relation to health and well-being of NHS staff, and also in terms of the healthy working environment. And again, that's going to be discussed in quite a lot of detail this afternoon, so I won't go into that in a lot of detail. So from the scoping surveys, the sort of key themes that came out were these, and I think a lot of them are, fairly obvious, but also it's great that people are actually saying, yes, we need it across the whole span. We need it in our job description. We need to be better in terms of our confidence. We need to have core learning opportunities, etc. So I think these were fairly popular themes throughout. We also asked about people presenting case studies, and this is always a difficult one in terms of getting the same sort of objective for each case study. But we've had some really, really interesting examples in. And again, this is a bit wordy, but I just wanted to show and demonstrate that as a group of AHPs across Wales, we do have examples of practice across all the different domains of public health. So if we look at the wider determinants, which is probably a more difficult area for us to demonstrate, we are getting involved in influencing strategy and policy. We are supporting vulnerable communities. The SHEP programme in relation to holiday hunger and education is a good example of that. Speech therapists are getting involved in youth offending services in relation to young people who've got speech and language difficulties. And dementia-friendly and falls prevention strategies. So we are getting into those areas. In terms of health improvement, I won't do a lot about that because that's our more sort of common area that we're used to doing. Suffice to say that the building capacity of the nutrition skills work is a key area of health improvement. And of course the MEC work, I'm just going to put up a slide which isn't available. I was hoping to bring this along as a flyer, but it's not quite finished. There's a couple of little mistakes in the language, so I wasn't allowed to print it off. It's just about to go to the printers. So my MEC colleagues told me. But, it just goes to show that, over 90% of people who had a conversation with a health profession about something other than what they were being treated for said the conversation was helpful. So this is a piece of research that was done by Public Health Wales and demonstrates that it is worth talking to our clients and patients and customers around healthy lifestyles. If we look at primary community and integrated care, then this is probably the biggest area where we have a lot of work, obviously because that's where a lot of us do provide services. And there's been some really excellent examples, ranging from the sports disability one with children, speech and language therapy in early years. We have a speech and language therapy in every Flying Start area in Wales, looking at early identification of speech and language needs. Cardiff Flying Start Nutrition and Dietetic Service supports the best start in life through their cascade of nutrition training and support to staff working with families around early nutrition. And further examples are around rehabilitation, preventing admission and enablement. There's an example in Monmouthshire around the amblers, around increasing people's confidence with outdoor mobility. And there's a potential for that to be rolled out. So a lot of these case studies, we need to be looking at how effective they are on a local basis and whether they can be rolled out on an all Wales basis. I mentioned the Disability Sport Wales project in North Wales, and then all the work that we obviously do on supporting self-management. Finally, in terms of health protection, I thought, oh gosh, we won't have many examples of that perhaps, but of course we do. And OTs work very closely with housing in terms of making sure that new housing particularly meets the needs of the client groups that they're working with in order to secure the best accommodation for their needs going forward. And the orthoptic service looked at the identification of gaps in service around not achieving a consistency of approach across Wales and achieved the outcome of all areas now and taking the screening programme. So we want to build on these, and we want to ensure robust methods and to demonstrate the value and impact of services. And how we share that, we do now have a page on the Public Health Network Cymru, and I think this is again the start of our sort of network and community of practice journey. At the moment, it's just a page saying who we are, and we need to make that more active, more interactive, and again, those ideas we need from you as to how we can make this work in Wales. So in order to create a sort of stronger movement and a stronger network, and I know that Linda will be talking about her experience in that area as well. In terms of the MEC work, there is a MEC website, which I'm sure most of you will be aware of, but just to again reiterate that this is available to everybody on the web, and AHPs can go into there, look at podcasts, look at videos, look at how to do the online training, tips, etc. And there are more resources coming literally as I speak. So that's a very useful. So in summary, what's next? We start with today and hopefully achieving some progress in looking at our action plan today. We've got a lot of existing public health activity as we've demonstrated. There's a lot of gaps still, but that's fine. We've got a collective ambition to drive this agenda supported by the national policy and strategy, and we've got scope for further leadership and coordination. We need more robust evaluation and outcomes, and we're going to be looking at that today, and working together across the UK to further increase our profile. And I'll be passing on to Linda to talk on that basis. And diolch am wrando. Thank you for listening.